Hi, my name is Dr. Rafi Israel, and I'm an ophthalmologist for the last 25 years, and I'm a co-founder of Micromedical Devices. And you have probably seen my videos before on the internet. What I'd like to talk about today is virtual reality visual field analyzer, which is this device that we came out in 2018 as the first company that came out with this technology. But now this technology has grown and has become a much more than just a visual field analyzer. So in addition of being a visual field analyzer, the machine can now offer multiple of tests such as FDT, vision screening, which contains um, visual acuity, contrast sensitivity, stereopsises, and color vision tests such as Ishihara or T15. There's a dark adaptation module that you can use to measure the bleaching of the retina and cones, and the intersect time. There's a strabismus measurement that measures the eye motility and the alignment of the eye in both distance and close up. There is a vision therapy monitoring, which shows how patients are using both eyes to do their work, such as reading a paragraph or following a circle or a square. There is a threshold color test, which tests each cone, the red, green, and blue cone sensitivity to the color individually. And then there is the pupillary response test, which measures the scotopic and photopic pupillary diameter. It measures whether the patient has APD, reverse APD, measures the contraction velocity and contraction acceleration, and offers it in a report to in a comprehensive report to the doctor. So why do you need all of this? Well, first of all, for many of these, there is actually a code that you can use to bill insurance. But if you're like me and experience the low payment from insurance, you should not be saying that I don't need a device, because you still need a device. For example, the number one use that I use the device in addition to the visual field is both the strabismus monitoring and the pupillary response test. So one of the most important uses for the device in my office is to try to see which patient is a good candidate for the multifocal or premium intraocular lens implant. Uh, the pupillary measurement is a must, because you need to know a minimum pupillary diameter and maximum photopic and scotopic pupillary diameter. And also, what you can't find in other machines is that whether the patient has any APD. Is the visual pathway working properly? Is there any damage to the optic nerve that you haven't seen before? Because a lot of times the ophthalmologist, when they come to visit the patient is already dilated, and it's very hard to elicit any APD effect at that point. So I use the people response test for all the patients that undergo premium intraocular lens, not only to measure their pupillary size, but also to measure their pupillary response. Next thing is I measure the strabismus module, not only on kids, but I have some kids that come in and obviously have some strabismus that they need present or they need correction, but I use the strabismus module on people undergoing premium intraocular lens. Why would I do that? Because I have found that a great number of people, I would say up to 20 to 25% of the patients that come in, have some sort of convergence insufficiency. This machine picks up the entire convergence amplitude, and it sees exactly at what point you have a convergence insufficiency. That doesn't stop me from placing premium intraocular lenses in patients. However, it makes it that I can instruct the patient that they do have this problem. And when they look at a close up to try to read, one eye is reading and the other eye is not turning enough, so they're using mostly one eye. And I like to tell them that so they know this beforehand, because as we know, with the premium intraocular lenses, it works much better in the reading when both eyes are reading together. So these are the sort of things that I want to do before I do my test. I also, some patients that have any sort of corneal abnormality, such as like an old scar or old opacification, I also do uh, I do the contrast sensitivity using the device, because like to know what the contrast sensitivity on those patients are before I place intraocular lenses. So this is just a brief video to let you know that this machine does a lot more than just a visual field. We were the first one in the market, as you know, with this technology, and we still have the patent on this. But now the machine has gone way beyond visual fields, and it can offer a lot more to the doctors and the patients to diagnose patients much faster, much better, and be able to follow them over time and have reliable reports that are reproducible, and you can see it every time patient comes in, whether they're getting better or worse or what their standing is. Thank you very much for listening. Thank you.
Visit micromedding.com or call 818-222-3310 to schedule your free demo.